Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. It's Dr. Daniel Ronel. We're having a great discussion with Dr. Maria Rodriguez, a gynecologist in Santa Fe, the only person really in the state of New Mexico right now who does vaginal rejuvenation.
And who should be doing it.
Right. So one question is, what is the age range of patients that you have?
Well, the majority of the patients that are seeking this procedure are generally women who've already had their children, mainly because the ravages of childbirth have really changed, you know, the vaginal opening and their sensation. So most of the time, it's women that are past their childbearing age. On occasion, you may have a very young woman who wants the labiaplasty, mostly because they are not pleased with the appearance or they feel that they're too large. You know, young women today are really, you know, they're much more aware of themselves in that area.
Yes.
They shave the pubic hair, and so they're just more aware of what it looks like. And so, again, some of those patients are seeking this procedure. In general, I would encourage women to wait until after childbirth, but, you know, if you have someone who really needs to improve their self-esteem, I feel that this would be an acceptable procedure to do.
And if they get stretched out after childbirth, they can have the procedure again. I don't think it interferes with childbirth, and there's no point in delaying, you know, gratification for something that really affects your self-esteem until, you know, for 10 or 20 years until you have children. So, no, I'm glad that you will consider doing it in younger women. Obviously, they need to be mature enough to understand the implications. You know, I get asked to do this a lot, and I used to do vaginal reconstruction for cancer in my residency, and I recognize how difficult that is to do. And there are some practitioners who aren't gynecologists who do vaginoplasties, and I'm sure that you see some of their work and have to fix it.
Well, once again, I think being a gynecologist and with the experience that I have in all of the vaginal reconstructions that I've done over the past 25 years, it's really important to know the anatomy deep in the vagina. And some people that are not gynecologists tend to work just very superficially in the entryway, and I can't imagine them getting too deep in the vagina. I don't think that would be very safe for the patient. So I really believe that gynecologists should be the ones doing this type of procedure.
I completely agree. I mean, this is why Dr. Ronel won't do it, because this is not his area of expertise. These women should be going to a gynecologist for this. Excellent.
You see advertisements for laser vaginoplasties. What are your thoughts on that?
Well, Dr. David Matlock in Los Angeles coined the term laser vaginal rejuvenation, and he patented this terminology so that no one else could use it. And when I looked at learning how to do this procedure, I looked at his courses, and I also looked at Dr. Alansad from Laguna Beach. And Dr. Alansad actually showed me how to do the laser vaginal rejuvenation that Dr. Matlock performs, and you get much more charring of the tissues with the laser. So I really felt that I liked Dr. Alansad's approach better, and I decided to take his course. And he uses a very fine needle, so you can get very precise, and I really felt much more comfortable with that technique. And I still today feel very strongly that that technique is better, because I've spoken to other surgeons in other parts of the country who are doing Dr. Matlock's method, and they are not very pleased with the amount of charring that they're getting when they actually cut into the labia.
We talked about this the other day. I use a very fine tip for my blepharoplasties for the extremely delicate skin of the eyelid, and it's the needle tip electrocautery, and I would imagine that the vaginal mucosa is just as delicate, and so it makes complete sense to use the needle tip electrocautery. And the
Don't
laser,
get too doctorish on us here, guys.
Okay. The laser is just more of a broad energy source.
Yeah,
so
it's just another cutting tool.
Okay.
Right.
Okay. I just hear mucosa and some
Yeah, there's nothing
cauterization.
magic. Patients think there's something very magic about the laser.
Right,
And it's really just a cutting tool.
right, okay, good.
So what are some of the possible side effects that could happen?
Well, you could potentially get scarring. The tissue could potentially break apart if the sutures break. I think patients have to be very careful in terms of the kinds of activities they can do. We recommend that they don't do a lot of physical activity where they're really stretching their legs open. And again, you know, it's mainly possible scarring. There's always a possibility of pain with intercourse if scarring occurs. But again, we really try to inform the patients of what they need to be doing after the surgery.
So it sounds like the incidence of complications is relatively low.
It is, it's low.
I'm sure in qualified hands, board certified,
Right.
it's important. You mentioned something about G-spot modification. In the plastic surgery literature, there is something about this using a filler to inject in the area around
Even
the G-spot.
I've read about that, and I ain't no doctor.
Right, and so I just read about it, but I have no clue and no desire to do this. How, from the gynecological perspective, how do you address that, and why? What's the purpose?
Well, some women feel that when you amplify the G-spot, that it helps them to achieve orgasm easier. Again, you know, some people don't even believe that the G-spot exists, but I think once you get into this area, you do enough research, and I personally believe that there is such a thing as a G-spot. And for some patients, they just want to have that area made a little bit larger so that they can feel the sensation.
How is that done?
You have to pick the area where the patient feels the sensation that she would feel if you touch the anterior part of the vagina and you're back up near the cervix, and as you move towards the opening of the vagina, the patients will feel an area where it makes them feel like they would need to urinate. It's an interesting sensation, and usually you pick that spot and you put a little dye into the mucosa right there, and then you inject a filler, and there are various fillers that are being used for this procedure.
Which ones?
So,
I'm just curious.
I'm just curious because we use a lot of fillers in the face.
Well, some people are using like Juvederm,
I got that in my notes.
and then there's methylcellulose, but everybody's kind of trying different things in this area. So
Artifil lasts 5 years.
yeah, I know, that's what they're saying, because the vaginal, the G-spot amplification sometimes will only last for maybe a year.
Yeah.
And so,
Do you want
again,
to do a study?
do I want to do a study?
Uh-huh.
I don't know, maybe.
Okay.
We'll talk about it.
Okay.
Yeah, that's cool with Artifil.
Yeah, we'll do a study with. We could do a study with Artifil.
Yeah.
Okay.
Interesting. Okay, we
That's
got to
cool.
wrap things up.
Okay, contact information one last time.
My phone number is 505-989-3870, and my website is www.newmexicovaginalplasty.com.
All spelled out.
Yes.
And this is Dr. Maria Rodriguez, board certified gynecologist, happily doing vaginal rejuvenation in the state of New Mexico.
You've been listening to Talk 1260 KTRC, the Humanity Behind the Vanity. Thanks again to our sponsors, the makers of Artifil and the makers of the OnQ Pain Buster. We'll be back next week.